Most people ignore joint pain because they think they're too young for arthritis. This video reveals the warning signs at every age and what to do immediately. Every year, thousands of people lose their mobility because they waited too long. Right now, somewhere in the world, a 16-year-old is waking up with swollen, painful joints. A 32-year-old professional is struggling to open a jar, and assuming it is just stress. None of them think it is arthritis, because everyone told them. Arthritis is an old person's problem. Or 2018 study from Ohio State University found that arthritis has been significantly underestimated, especially among adults under the age of 65. The real numbers are likely higher than what official statistics even show. According to the National Institute on Aging, women are more likely than men to develop osteoarthritis, particularly after the age of 50. So let us go through the myths, one by one, and replace them with facts you can actually use. Myth: arthritis only affects elderly people. If you are young, you should not worry about joint pain. Fact: arthritis is the leading cause of disability and affects people of all ages, including infants, children, teenagers, and adults in their 20s, 30s, and 40s. This myth is dangerous. When young people ignore joint pain, they delay getting help, and the problem gets worse before treatment starts. Rheumatoid arthritis is an immune disorder where your own immune system attacks your joints. According to the Cleveland Orthopedic and Spine Institute, rheumatoid arthritis is typically diagnosed between the ages of 30 and 60, and it affects women more often than men. Gout is a condition that causes sudden, severe pain, often starting in the big toe and spreading to the ankle or knee. The Cleveland Orthopedic and Spine Institute notes that men are more likely than women to develop gout, and it typically begins after the age of 40. Myth: exercise makes arthritis worse. People with arthritis should rest and avoid physical activity. Fact: medical experts consistently recommend appropriate low-impact exercise as one of the most effective treatments for most types of arthritis. Movement lubricates joints, strengthens surrounding muscles, and reduces inflammation over time. Now, this one is especially important for our community. Many seniors have been told to take it easy, but inactivity actually accelerates joint stiffness and muscle loss. Walking, water aerobics, gentle yoga, and resistance bands are not just safe. They are often prescribed by rheumatologists as part of treatment. Myth: cold, damp weather causes arthritis or makes it worse permanently. Fact: weather changes may temporarily affect how some people experience joint symptoms, but weather does not cause arthritis, and moving to a warmer climate does not cure it. The root causes are genetic, immune-related, and lifestyle-based. Myth: if you have arthritis, there is no hope. It will only get worse. Fact: advances in rheumatology over the past 20 years have been extraordinary. Biologic medications, anti-inflammatory therapies, physical therapy, and nutrition-based interventions now allow millions to live full, active lives with arthritis. I want you to hear this clearly. Arthritis is a manageable condition. It is not a life sentence. The myth that arthritis only happens in old age is not just wrong. It is actively harmful, because it keeps people from seeking help when it matters most. If you or someone you know has unexplained joint pain, stiffness in the morning, or swelling in the hands, wrists, or knees, Speak to a doctor. Like, share, and subscribe this video with one person you care about.